Hello everyone. Today's video is about anxiety, a topic that's near and dear to many of us. And as pediatricians, we're seeing this much more commonly now, even in younger ages. We think about anxiety in teenagers perhaps and post-puberty, but actually we're seeing it now in 4 and 5 and 6-year-olds, which is so sad, but very common. So I hope these tips tonight, while not comprehensive, will be helpful to you. First of all, many moms or parents ask me if this anxiety is genetic. Well, probably. Many things run in families, but like so many other things in medicine, it's probably both nature, genetic, inherited, and nurture, environment. And often the parent can influence both of those things. So you can't help what genes you may have passed on, but you can help the environment to try to reduce stressors. Don't leave the evening news on when it has scary things on it that could increase the anxieties in the child. Don't overly share things that you're worried about that could increase the anxiety level of the child as well. So you can't help your genes, but you can help the environment. Do what you can. Limit screen time to always under 2 hours for any age and under 1 hour for children younger than age 5. Don't allow screen time before bedtime. Don't allow screens in the bedroom. Try to enforce a very structured environment in your home. The same wake-up time, the same sleep time, the same rules, the same limits. Children should know what's expected of them, and that helps reduce their anxieties. Also, I want to remind you, one of the main ways children reveal their anxieties is through feelings of abdominal pain or stomach ache. If your child is frequently complaining of a stomach ache, but can play through it, doesn't have a fever, isn't vomiting, has a normal bowel pattern, no problems with urination, think about anxiety, and many times that is the explanation. I know of so many children who have been through extensive and expensive medical workups for abdominal pain, and physically there was nothing wrong. Anatomically, structurally, everything was fine. That was just how they manifested their anxiety. That doesn't mean they're trying to manipulate you. It means that they're stressed enough that their body's releasing catecholamines and stress hormones, and they actually feel pain. But often when their anxiety is dealt with through counseling or when older, sometimes medications, the abdominal pain complaints really decrease. So that's pretty interesting. I want to tell you about things that you can help for your children to feel less anxiety. In younger children, often counseling is beneficial. It's not mandatory unless you're starting to see actual changes in their functioning level. For teenagers, it's also very helpful, and for teens, sometimes medications can also help along with the counseling. The main category of medicines we use for anxiety, the category is called selective serotonin, reuptake, are inhibitors, SSRIs. So when you hear that terminology, SSRIs, you'll know that it's a medicine that helps the brain have more serotonin, which is sort of a feel-good neurotransmitter in the brain. Other things you can do naturally to increase that: exercise. We release endorphins when we exercise, which help us feel better, and also daily exercise can lead to better sleep at night. And you know there's an intimate connection with quality of sleep and anxiety. If you're having a lot of anxiety, you can have poor sleep. If you're having poor sleep, it can increase your anxiety. So you can see how those things are so interrelated. If you have questions about sleep hygiene, which I feel so passionately about, please reference the other video on sleep hygiene, and that can help a lot too with some of these anxieties. So now let's talk about if your child is presenting signs of anxiety or they're complaining of fear to you, things that you can do. First of all, when the child says, "Mom, I'm afraid of the dark," or "I'm afraid of the monsters under the bed," it is not okay for you to say, "You're not afraid," because that's invalidating their feelings. We want to validate their feelings. "I'm sorry you're afraid, darling. I've been afraid before too, and it feels yucky. I don't like feeling afraid. I know how you feel, and I'm sorry." So you're telling them, "I believe your feelings, I validate your feelings." But it is okay for you as the parent then to offer reassurance. You are safe. Mommy and Daddy are home and the doors are locked. There are no bad guys. You've been safe all the other nights, and you're going to be safe tonight. That's okay to offer reassurance. That's not invalidating their feelings. That's just what you're supposed to do as a parent. Now, we have other strategies we can use as well. First of all, since the parents of children with anxiety may also have anxiety, you should do all the self-care tips for yourself as well. Get good quality sleep, between 8 to 10 hours for most people. The same bedtime, the same wake-up time. Very structured daily cycle and rhythm. Make sure that you're having quality sleep so your anxiety is low, so you don't project onto the child. Make sure they're having quality sleep. Make sure you're eating healthy. Have a good diet, especially the Mediterranean diet. Nuts, whole grains, fresh fruits and vegetables, blueberries, and things rich in antioxidants can help prevent depression and help you feel better. So both you and the child should be getting regular exercise, healthy sleep, healthy diet. Other tips for the child are, if they're old enough, try to get them to articulate their feelings. If they're old enough to write, try to get them to keep a journal and write down their feelings. They can even sometimes make a list of things I am worried about. And sometimes once they get those things they're worried about on paper, they don't feel quite so worried about them, which can be helpful. Help them remember past successes. If they're stressing about the EOGs, remind them that last year they did okay on the EOGs and it's going to be all right again. Help them anticipate success. Tomorrow, when we're in car riders line, you're not going to be scared to get out of the car and go into class. You did it yesterday successfully. I know you're going to do it tomorrow successfully. You can do this. I believe in you. I think it's going to be okay. So remember past successes, anticipate future success. Work through worst case scenarios with them. Some children, in that same example, car riders line, are afraid their parents will forget to come pick them up. So you could work through it. If you were left on the sidewalk at car riders line and your mom never came, are you by yourself? No, there's a teacher with me. Does that teacher know who your teacher is? Yes. Does your teacher have your mommy's phone number? Yes. If your teacher calls your mommy and tells you to pick you up, will she come? Yes. And just work through that with them. So playing the worst case scenarios can sometimes help the child. Now, what if you, with the child or a teen, are in an acute panic attack situation? First of all, you can help them order their breathing. What the younger children will do, breathe into the top of the mountain and let your air out to the valley. And you do that for every finger. So 5 slow, deep in and out breaths to order their breathing. If that doesn't work, help them to sing. Sometimes singing makes you breathe in a particular order, and that can calm your fears, especially if it's a song that they find soothing, or maybe you help them sing them to sleep. You are my sunshine, my only sunshine. You see how you have to breathe at a certain time, and sometimes that helps them. You can also use Benadryl, just plain children's liquid Benadryl, or the chewables or the adult tablets for older teens based on their milligrams per weight that you would use for other purposes of Benadryl, but it can often help with a full-blown panic attack, and even psychiatrists do this. So these are some of the tips we use. You can help them do guided imagery or focused imagery when they use all 5 senses to think about a specific place that helps calm them down, what their memory in that place of what they were tasting, what they were smelling, what they were hearing, what they were seeing, what they were touching, and that sort of derails that train of panic that's just been barreling down the track. A lot of times that's helpful. The other big thing I wanted to mention today was that many times, anxiety is a comorbidity of other mental health issues such as ADHD, such as past trauma, such as depression. And anxiety and depression can often be different sides of the same coin, and in different seasons of life can present in different ways. So if your child with anxiety starts to have different symptoms, such as a loss of pleasure in activities that were previously fun, a drastic change in appetite either up or down, a drastic change in sleep patterns either up or down, and definitely if they ever said anything very concerning like, I wish I'd never been born. You wouldn't notice if I weren't here. Nobody would care if I wasn't around. Anything like that, that's a drastic cry for help. You should never assume that they're just trying to be manipulative. Assume that that's a genuine cry for help and they need to have an emergency evaluation. Make sure your home is safe if you have any fears at all about a child with self-harm threats, and remember they need immediate medical attention if they're making any threats of self-harm or have any suicidal ideations or thoughts of hurting themselves or ending their lives. That is critically important. For some of the teens who do need to be treated with medications such as SSRIs, often the dose for anxiety is actually higher than the dose for depression. So at least if they're on medication for anxiety, that is going to help also with some of those depressive symptoms. And like I said, it is always a good idea to get counseling. It's just that it's mandatory when the symptoms are beginning to actually interfere with their functionality. So this was a very quick, very much not comprehensive coverage of anxiety, but I hope that it's been helpful for you and hopefully your child. Thanks.